BioVendor has a long tradition in development of immunoassays as well as antibodies and recombinant proteins. Our ELISA kits for determination of biomarkers in various clinical fields have gained a good reputation and were frequently referred in top-class scientific journals. Now, I would like to talk about biomarkers of bone and cartilage metabolism and will tell you which of our immunoassays are really relevant in diagnosis and research of bone and cartilage disorders. Here is the list of the most important BioVendor kits from the area of investigation. At the beginning, a few information about human cartilage oligomeric matrix protein, shortly COMP. It is a protein important for integrity of collagen network. During degradation of the cartilage, COMP is in large extent released into the synovial fluid and then into the bloodstream. Therefore, COMP is a very good prognostic marker for inflammatory bone and cartilage disorders, namely osteoarthritis and rheumatoid arthritis. COMP is referred to by some clinical scientists as novel biomarker of malignant disorders such as breast cancer and hepatocellular carcinoma. Osteoprotegerin, shortly OPG, is secreted soluble protein that plays a key role in bone remodeling. Together with sRANK, also called sRANKL receptor, compete with each other for binding to their ligand sRANKL. At normal physiological conditions, are OPG and sRANKL in balance. Different changes in sRANKL-OPG ratio are associated with many bone and cartilage diseases, such as osteoporosis or osteolysis. OPG alone is a very good predictor of coronary artery disease development and good indicator of early progression of the prostate cancer. To the most commonly used markers related to the bone and cartilage metabolism belong vitamin D hand-to-hand with parathyroid hormone. Now a few words about vitamin D. Vitamin D is a group of fat-soluble secosteroids responsible for intestinal absorption of calcium, magnesium, and phosphate. Vitamin D from diet or skin synthesis is biologically inactive. First of all, vitamin D is enzymatically converted in liver to the main circulating form hydroxyvitamin D. This provitamin is further hydroxylated in kidneys to active form of vitamin D, dihydroxyvitamin D. It's involved in bone resorption and mineralization. However, dihydroxyvitamin D has two main disadvantages. First, its concentrations are 100 to 1000 times lower compared to hydroxyvitamin D, and secondly, it's rapidly metabolized. Due to mentioned disadvantages, many clinicians and scientists prefer for the estimation of vitamin D status related to the bone mineralization, hydroxyvitamin D assays. Here is the overview of appropriate ELISA products. Besides immunoassays, we normally offer also proteins and antibodies. In the next two slides, you can find selected ones. Here is the list of BioVendor proteins. And here is the list of BioVendor antibodies. So, I believe you have found something interesting in my presentation also for your work. But it was just a little testing of a wide offer of BioVendor biomarker immunoassays. Visit us at BioVendor.com website, where it's very easy to find an ELISA kit, protein, antibody, or microRNA immunoassay meeting your needs. Feel free to contact our product managers and ask for help. Thank you for attention.